Hey everyone, it's Denise Brown from the Caregiving Years Training Academy. Thanks so much for joining us. This is our big ideas. We're going to share 2 ideas today. Each idea is going to be about a 10-minute presentation. We're going to go back to back with our ideas and then open it up for a conversation about our ideas. And Sheri is presenting our very first idea. So Sheri, take it away.
Good afternoon, everyone. I'm Dr. Sheri Yarbrough, and it's my pleasure to share my big idea, becoming the care team leader. My big idea comes from lessons that I learned from caring for my mother. My my first my first lesson was that a loved one's care needs rarely shows up like a scheduled delivery package. Our care journey began when I walked into a routine doctor's appointment as a daughter and walked out as the caregiver of a dementia patient. Um, what I didn't realize at that moment was my second lesson, and that is that in every family there's a go to person. Though I had known for many, many years that I would probably be the sibling to care for our parents as they aged, I didn't realize that the moment I walked into that appointment, I would become the one. Being the one meant that I had to manage my mother's life as well as have a life of my own. It was up to me to keep her safe, both physically and financially and emotionally, and do the same for myself. And so in that space, I found myself doing it all at once, all by myself. And in that space, I presented a good face to the world that I call my mask of tolerance, that belied all of the underlying feelings of being overwhelmed and stressed and uncertain about what I was doing. And most importantly, being uncertain about whether or not I could do everything. I spent about a year with that, and the tiredness of being the one made me accept the fact that I really was only one person and that all that I was doing was more than one person could do. And so, if I were going to fulfill my commitment to my mother, I needed help. I needed a team. I also realized that if I were going to have a team, I was going to have to be its leader. So, oops, doing 2 things. So, shifting from being the one to being the team leader challenged me to answer 3 really, really difficult questions. What do I want from the care relationship? What do I need to lead this care relationship? And who will help me get what I need? What made those questions so difficult was that I was brought up to believe that you shouldn't be thinking about your needs when you're supposed to be caring for somebody else. And just a quick little hand raise if that sounds familiar to anybody else. However, I realized that if I were going to break that doing it all at once, all by myself cycle, I had to identify my needs so that I could lead a care team. Um, Recommitting myself to caring for my mother, I knew that I had to have people around me who were going to support my decision making. So I had to define who that was going to be. 1 second. I found that I needed 2 categories of team members: professional and personal. Um, I chose them because of the skills that they could bring in lead in could bring to my team. Now, who those people are and the roles they perform are defined by your answers to your leadership questions. What you learn from answering those questions connect you to your instincts because no one knows you, and no one knows your loved one better than you do. As the team leader, that's what drives your decisions and your actions. And it lets you choose who will be on your team. And it also helps you manage the interpersonal dynamics between team members. Boop, boop. There we go. So, just kind of summarizing this, the difference between the two, team leadership, team leadership prevents you from having to make care decisions and take care actions in isolation. And that way, the caregiver can always be sure that she or he is going to get the support necessary to continue giving care. So my final thought for the day is today that there's no better day than today to build your team. So thank you for listening to my big idea, and I look forward to hearing your questions.
Okay, and I'm going to present next, and then we'll open up for a dialogue about the two big ideas. And Sheri, I'll just ask you to stop sharing your screen, and then I'll go ahead and share mine.
Okay.
Actually, you know what?
Stop share. There we go.
Yeah, I think I can do it. Okay. And thanks to those of you who are already sharing in the chat room, I would encourage you to continue to do that. So my big idea actually occurred to me probably about 8 years ago. I used to coach family caregivers. I'm a life coach. And I had a client who was caring for her mom at home. And in the 2 years I coached her, I was able to help her really start hospice at the right time, which was 8 months prior to her mom's death. And then she was able to really work with the hospice team in order for her to really find the right team members. So she didn't like the initial nurse, she was able to switch to a different nurse. What happened as her mom was dying, though, is that the nurse on call on the weekend was the nurse she did not like. And she didn't want that nurse to be with her during this really significant moment in her life. So instead of calling that hospice nurse, she called a neighbor who was a nurse. And that neighbor sat with Betty as her mom was dying. And then after her mom died, Lisa, the nurse, and Betty, my client, bathed Betty's mom and then took some time before calling hospice to let them know that Betty's mom had died. And in that moment, I thought, you know what we need? We need a care squad, someone like Lisa, who's in our neighborhood, who we call for help when we're in a situation where we're caring for a family member. So, some statistics for you that I always find so compelling. Think about it, 30 million Americans are living with 5 or more chronic illnesses. So that means that we have that many family caregivers, if not more, in the United States. And then if we think about how many people die every day, 8,000. But we also know that 1 in 9 are dying of COVID since January 20th. Sheri touched on this during her presentation of her big idea. We go to the doctor's office with our family member, we receive a diagnosis, and then we go home. We might have an appointment card for a follow-up appointment in 6 months, but we don't hear from anybody during that period of time. I remember going home with my parents after my dad's bladder cancer diagnosis. My mom pulled out the stool by the phone, the landline, this was in 2004, opened up the phone book, made the phone calls to let everybody know. And then we just let my dad absorb the news. But we didn't hear from anybody. We didn't hear from the doctor the next day to say, how are you guys doing? What questions might you have? I know this is a huge shock to the system. I've got a social worker on staff who could support you. There's nothing. And then we manage these illnesses and disease processes in our homes for as long as we can. We're advocating and managing and solving. We're calling the doctor when we can, And when we feel like we need to, for the most part though, we're trying to figure this out. And then we reach end of life for our caree, and we use caree for the person who's receiving care. That's the term we use. So we manage these last days wondering when the last moment will arrive. And we ask hospice for insights and suggestions, but we're trying to guess when that last moment will be here. Wouldn't it be great if we had a comrade, someone who's been through that already with us to help us figure out what can we do to make these last moments that much more comforting and memorable and important. So I think of a care squad as consisting of former family caregivers, so individuals who've already cared for a family member and want to volunteer, want to give back. I used to host a national caregiving conference. I hosted it for 4 years. Former family caregivers were the ones at the conference showing up to say, I want to make a difference. I want to help current family caregivers. So we have millions of former family caregivers in our country who are interested in giving back, and yet we have no real way to tap into their expertise to help them give back. What if we recruited them to be members of a care squad? I train former family caregivers who want to start a small business to become certified caregiving consultants. What if there's a certified caregiving consultant who organizes the squad, who's that point of contact for the family caregiver, who trains and supports and takes care of the volunteers and then connects them? The care squad could have regular visits with the family caregiver. The day after a diagnosis, maybe there's a virtual visit from a volunteer who's cared for someone who has a similar disease process that just checks in. How are you doing? You had a difficult day yesterday. Just wanted to see how you're managing. And then what if that volunteer said, we have monthly support group meetings that are virtual. Why don't you join us? And then twice a year, there's another check-in from the volunteer. And then as the disease process continues, maybe that volunteer has an opportunity to send samples of supplies that could be helpful. So before there's a time when there's incontinence, the volunteer says, just to be on the safe side, why don't I send you some samples of incontinence products so you have them in the closet? Wouldn't that be amazing? And then maybe there's monthly visits towards the end of life. And then as death comes closer, maybe there's daily, and maybe there's hourly visits. I think of the care squad as being in addition to home health and hospice. So the care squad can make those timely and appropriate referrals to home health and hospice because they'll know what benefits are available and when the right time is for the benefit because they've already been through it. So when I think of Betty, the family caregiver I coached, the inspiration for this idea, I referred her to hospice before her mother's doctor did. And when I made the referral and suggested that she call hospice, her mom's doctor said, are you sure? I can't do any more for you if you choose hospice, which obviously that's not the purpose and that's not the reason, but it's individuals like us who get it, that understand the timeliness of the right referral for those family caregivers. And I also think when we have timely referrals as family caregivers, we are effectively using programs. So we're not waiting for hospice until 2 days prior to a caree's death. We're starting hospice 6 months. So we're taking full advantage of the program and the services and the support. In addition, we know there's a shortage of certified nursing assistants, of home health aides. And I worry about the shortage with nurses and doctors because of COVID. So if there is a situation where a family caregiver needs to connect to a healthcare professional and that healthcare professional either is overscheduled and can't come for another couple days, maybe the care squad could just provide that emotional support to keep that family caregiver okay until the visiting nurse can be there. I also think about a crisis when we need help and support. So the care squad can be a part of that crisis management. if we think about who funds it, what if there's a Medicaid waiver program that funds a care squad, pays the salary of the consultant, and provides training and support for the volunteers so that they are taken care of too? What if it's an employee benefit? If a local corporation says, you know what, we've really got to take care of our working family caregivers, we need a program like Care Squad. And so when an employee is in a caregiving situation, HR refers them to the Care Squad, who then becomes this ongoing support. And what if it's part of a community program? And I'm going to tell you about an idea for a community program tomorrow. So here's your call to action. Think about how you could create your own care squad. So this is an idea right now. There is no funding. There is no organized recruiting or structure for this. I have tried off and on over the past 8 years. I just haven't been able to figure out the right partners to make it happen. However, it could be something that you could think about doing for your own caregiving experience or within your own family. Who's your care squad? Who could you call when you need someone to pick up medications from the pharmacy because you're having that kind of a day? Who could you call if you think, "Oh, I'm just not quite sure what to do about this?" Who could you call when you think, I think we need more help? I wonder who knows who's a good home health agency. Who could you call if there's a situation where you're wondering, I'm not sure if there's something wrong and I'm not sure if I know what to do? Who could you call just to talk it out and brainstorm? Who could be your care squad? And maybe what you create is a care squad for yourself while volunteering to be on someone else's care squad. So you come up with the idea, you recruit members of your care squad, and then offer to be a volunteer for others and be a part of their care squad. Okay, so that's my idea, a care squad. So I'm going to open it up I'm going to stop sharing. I'm going to open it up for questions. And you are welcome to share any questions or insights or feedback in the chat room. And if you have any questions and you'd like to unmute yourself, feel free to do that. So I guess my first question is, what did you think of our two ideas?
This is Rebecca. May I speak?
Yes, go for it. Hi, Rebecca.
Hi, Sheri. I really appreciated what you had to say. And I think it was remarkable that you knew that you had to get a team together. I mean, you've never done this before, and you said, I can't do this alone. And Denise, I love your idea of a care squad, because so many people go through this alone, as we said, the one. But during this time of COVID, it's hard to get people actually physically helping you. And most people, a lot of people are facile at getting on the computer and exchanging ideas. And, oh, I see that your mother looks like she has this, and what about that? How can we proceed during this time? Because, it doesn't seem like COVID's going to be over as soon as we had anticipated.
Sheri, I'll let you start. Oh, there you go.
There we are. Technology is a wonderful thing. And I think that in this era of COVID, more people are engaging that way. And so you've got people doing their family Zooms. I've had an opportunity to work with the doctors, and they're doing virtual virtual sessions. So I think that people are becoming a lot more comfortable with it. It's a little more awkward when someone needs that physical care, if the person's having an emergency or a wound doesn't look right or something like that. And that's why having, I call it Team Loved One, and Denise, you call it the Care Squad. It's about having people around that you can call and have a 15-minute video chat with to say, I'm not sure whether this looks right. My mother has dementia, but she also is a breast cancer survivor. So in those days right after we got home, having the doctors say, you should get a home care nurse, and helped me set that up. Having somebody that I could call, and at that time, I call it BC, before COVID, the care nurse actually came to the house, and she said, no, she's moving in the right direction. The coloration is fine. So I think technology it's great. People just have to feel a little bit become comfortable with it, because I think that's one of the things that's going to help us navigate this physical distancing that we have to do.
So there's a couple thoughts for you, Rebecca. I spoke with a colleague who is a home health nurse and actually leads a state organization in March. And we were talking about risk assessment as it relates to having a home health aide come into the home versus not having someone come into the home. And the risk is without a right amount of help, we are risking our carries admission to a hospital. So, for instance, in my situation, my parents live nearby, and I have a niece that helps them 3 days a week. And it started because my dad fell in the apartment and then was hospitalized because he had sepsis. And so once he went home, we had been trying to get them to have more help. It was obvious that they needed more help. And because they have help now, honestly, they're at home. I just shudder to think if we didn't have more help for them. So it's all about this risk assessment. And family caregivers on a regular basis are assessing risks. So the risk is too great in some situations not to have help. I also think that we're missing an opportunity with virtual visits from home health aides. So, home health aides also have concerns about their exposure to COVID. Understandable. They have to keep their family safe, they have to stay safe. They have this expertise, though, that could be invaluable through virtual visits. So, I could have a home health aide virtually visit with me and my parents and take a look at, for instance, my dad also has skin cancer on the top of his head. Maybe she looks at the supplies that we're using and says, I have another client that uses a different kind of supply. Or she could look at the closet where we keep our supplies and say, what I would do to organize that a little better is this. When you go home from the hospital with your caree, you might have to give your carrier a bath or a shower for the first time when they are different. So they've had a decline because of a hospitalization. Wouldn't it be nice if the home health aide called you up before and said, okay, this is the first time you're going to give your mother a shower. Let's make sure you're ready. And then gives all those great tips that a home health aide knows. Let's get those bath towels in the dryer so they're nice and warm when your mom comes out of the shower. Let's look at how you've got the bathroom set up so you have all the supplies handy. Let's look at what you've got on the floor to make sure your mom won't slip. And let's just take a quick look at body mechanics just to make sure that you're taking care of yourself while you're helping your mom. Okay, go ahead and give her the shower and then call me back in a half hour. And then in a half hour, you have that follow up. This is what happened. This is how it went. This is how I did. And that home health aide can say, great. Now you know. Here's a couple other tips. Just that emotional support from someone who knows how to do it in such a organized, amazing way can be so helpful. But we go home from the hospital having to do these new tasks without anybody holding our hands. And sometimes what we need is just someone to hold our hands. And who better than a home health aide who's always holding a client's hand? Now they're just holding a client's hand in a different kind of way. And I think about our worry about shortage of home health aides in our workforce. I would imagine a home health aide might be more open to a job that's virtual where they don't have to travel, they don't have exposure to COVID, but they are doing something that is truly valuable, truly makes a difference for their clients. So to me, I think there's that many more opportunities with virtual visits than what we're looking at right now. I think I answered your question, Rebecca.
Yes, very well. Thank you.
You
I
know,
like the idea.
oh, yeah, go, great. Charlotte is here from Iowa. She's a parish nurse. I'm going to kind of put you on the spot, Charlotte. And I wonder what you think about what needs you see in your community around family caregivers and what you would like to do to solve them. Let's say you've got all the money in the world to solve a caregiving problem in your community. How would you solve it? So I'm putting you on the spot. I appreciate it. You are welcome to unmute yourself or just share some thoughts in the chat room. I guess actually I'll ask that of everybody. If someone gave you $1 million to solve a problem that you see in your community that family caregivers encounter, how would you use that $1 million?
I would use some of that money to make sure that no one person is home alone with their carry, because I work as our parish nurse and have a monthly caregiving support group. And currently I have 4 couples that are taking care of their spouses. And because of COVID, the kids are working outside the home. These are adult children. They don't come over because they're afraid to bring COVID to mom or dad. They'll bring the groceries, put them in the garage, but 3 out of 4 of them didn't even see their kids for Christmas except via Zoom. And it's very depressing for the caregiver and the caregiving. But you know, when you have dementia or Alzheimer's, I don't believe, and I know because my mother-in-law died from Alzheimer's, they don't have that awareness that they're alone as long as somebody's in the house. But the caregiver, they're so isolated, especially now with COVID. So I would make sure somebody was in that house with them. And in our area, we do have health caregivers coming in, but reluctantly, and most of the reluctance is on the side of the family where they're going in. The kids that live in New York say, "Oh, Dad, you can't have help because they'll bring you COVID." And they have no clue that what he's going through to keep their mother safe. She's a wanderer. The neighbors have picked her up on the street. It's very, very difficult. So the first thing I would address is their aloneness, because it's hard to be so alone when somebody's sick.
Absolutely. That emotional isolation truly takes its toll. And I also think if we had something like a care squad that's well funded, we could actually purchase PPE so that anyone that goes in the home puts on PPE and anyone in the home puts on PPE. There is no way to distribute that to individuals right now. So when COVID hit in March and April, some of our certified caregiving consultants were going to an auto parts store to buy supplies because that's where they found what they needed. Could you imagine? I mean, we're just kind of going by the skin of our teeth trying to figure this out when we really could have something that's organized so people could have access to supplies that they need when they need them. And if we have a care squad, it becomes this buying cooperative as well. So you could get a break on supplies, for instance. So if the care squad enrolls participants, so to speak, maybe the participants pay for their own supplies, but at a cheaper price because it's a buying cooperative.
I think the care squad's a wonderful idea. And I'm actually thinking of several people I know in our parish that maybe would be willing to share what they went through. Because that's the one thing about the caregiver support group. We used to meet in person once a month. Now we're doing it virtually. But when you're talking with somebody and they have an idea of how to help differently, it's an invaluable asset to the caregivers. Invaluable.
Yeah, and it helps so much to talk to someone who gets it. I think sometimes we are a little intimidated by healthcare professionals just because, I will tell you from my perspective, I've had situations where my dad has had terrible skin breakdown and I have felt horrible. And I've been so worried about what a healthcare professional will say to me about it. I mean, I didn't hide it, but I was just so freaked out. And to be able to talk to someone who says, "Oh my gosh, wound care is so hard. It is a bugaboo. It's terrible. Of course you're having a problem with it. That would have made me feel so much better. That it wasn't me failing my dad. It was just a disease process that was really tough. Okay, Charlotte, I put you on the spot, but that was excellent. Thank you so much. Thank you so much.
Thank you.
And I think Deborah wanted to jump in with some thoughts. Deborah Swing, would you feel comfortable unmuting and sharing some thoughts? And then we're going to go to, oh, go ahead, Deborah, go ahead. And then I'll.
No, go ahead. Sorry.
No, that's okay. I kept going. So Deborah, go ahead.
Sure. I love what you're doing, and it's just also valuable. I'm almost afraid to tell you I am an RN.
Okay, that's okay. No, that's okay. We love RNs. We love RNs.
But I totally understand what you're saying. But any good health professional would do what you said and reassure you that that is a difficult area to care for. I myself took care of both of my parents for 23 years, and my mother's wish was she was married a second time because my first dad was killed in an auto accident, but she wanted to remain home, and we managed to make that happen for her until she was 97. So I went through all the challenges, and even as a nurse, knowing how to navigate healthcare, just being new and navigating home care and services and staffing, totally understand that, and the changes in condition and mental capability. I totally understand the need. So that led me to do what I do now, which I am doing care coordination for individuals at home. So it's those that want to remain home, elderly that don't want to go to a facility, or those who have had surgery or short-term rehab, and they just need that extra coordination. And that's all very, very valuable in transitioning them from the hospital to home, that communication. And so a lot of the things that you're sharing, that's a lot of what we coordinate and make sure that that communication happens, that they're monitored. We had an individual that he didn't want to check his blood sugar, and it was very high. And so we got him a phlebotomist and started checking and monitoring his blood sugars till he came down to a healthy blood sugar level. Had we not intervened, just even by the doctor's admission, he probably would have declined in health, and his blood sugar would have remained out of control. So that intervention is just so important. And you mentioned the timeliness of that. And with hospice, had the same situation with a client where the wife wasn't quite accepting where he was at in his progression, but I knew he needed hospice on board, and I knew that what would help him with that staffing and that extra care and supplies and resources. And so, she understood then, with some education and support, emotional support, that was a good thing. And sometimes people don't realize hospice doesn't always mean end of life immediately. I know the guidelines are, within 6 months, but I've seen in my career, many people go on hospice, and because you have the coordination of care and then you have hospice on board, they improve and they come off of hospice. So
yeah.
So that's possible too.
Yes. Yeah. Thank you so much. And you know what? You made me think of something, and that is, when you're a family caregiver, you know that the tricks of the system. So for instance, I know on discharge day in a hospital, one of the first things I do is get a wheelchair, because we've been in situations where we finally get the order for discharge and then we're waiting for the wheelchair, which is the worst. So it's those kinds of tips that someone can share with you on how to navigate through the system so that the system and you work together more effectively. You're thrown into a system that does not make sense. And if someone explains to you how it works, then you can say, okay, I know how to fit in this system because I get how it works. And I think Sue wanted to jump in and share something. Oh, Sheri, did you want to mention something? Sheri,
Yes,
we'll go to you, and then Sue, we're going to go to you.
yes, that's what I mean by having those professionals on your team. So a person like Deborah, who is a home care nurse, who can help you figure those things out because you're not going to know. And then also having those family members who can be the person who takes the handoff from time to time so that you don't have to do everything. It's it's so important. You've got
Yeah.
to have those professionals, and you've got to have those professionals who are willing to support your decision making.
So I just want to mention something, Sue. I'm going to ask you just to give me 30 seconds. So we're talking in the chat room about unused PPE and how to share it with family caregivers. That's actually something we could do for any kind of supply or equipment. In my suburb, we have a loan closet in a local church. But what if there was a better way to organize it so that when caregiving ends, that former family caregiver has these supplies, and it's an easy way to give those supplies to a current family caregiver. Even, for instance, if you have a box of supplies that you've already opened, you can't do anything with them. But if there's another family caregiver that says, I don't care that you opened up the box, I'll take those gloves, then it can be a nice way to kind of use what's unused in a really useful way. Okay, Sue, I'm going to stop now.
I just typed in that I work with IDD individuals and families. I'm a respite hirer, I guess is what you want to call me. I coordinate and do the stuff for Envisions Unlimited in Central Illinois. So I cover 18 counties. But I find that a lot of families, whenever I'm working with them or calling them and talking to them, they don't understand all the waivers and things that are in
Yes.
place in Medicaid. So
Oh,
when I call them and I say, do you have a REN? They don't even know what a REN is. Some say, well, I make too much money. And I go into explain to them that a REN is something that they're going to need for their child now, later. It's going to get them more services. I think that educating and going, like right now, I'm trying to get into the schools, to go to the schools to help educate the parents because they don't understand what is out there for their children. They don't understand how to get services and how important getting that REN and that those waivers are there for them. So I think that's a big key into helping.
yeah, I love that idea that Care Squad could be for any situation where caregiving takes place. And it could be parents that create a care squad so that other parents who have a child with special needs has an understanding of how to work the system, the school system, the healthcare system, so that they save that family time. And sometimes our most valuable resource during caregiving is time. We don't have enough time.
Right. And it's just it's a wonderful program and it's ran on grants through the state. And, it's not a lot of hours, but it gives the family a break because a lot of the caregivers need a break just to go to the doctor themselves, to do different things, just somebody to come in, maybe let them even take a nap. They're just exhausted. So I think it's a really good thing just to get out there and educate people on what needs to be done or what they can have.
Yeah, thank you, Sue, and thank you for being here today. You were with us in January for our Healing After the Holidays event. It's good to
Yes,
see
I
you.
was.
Good to see you again.
Thank you.
I started surveying family caregivers about their stress in 2015. I asked them to pick a number between 1 and 5 that designates what's their stress level. So about 1,800 family caregivers have completed this really simple survey. And the stress number has always been 4.13. It went up to 4.17 for a period of time. And then I asked them to pick what's the cause of their stress. And Sue, you made me think of this. And it is that they miss their lives because there isn't time for their lives. And sometimes there's not time for their life to rest. And I think you sometimes miss who you were when you felt like you were this well-rested person. You miss your ability to be patient and compassionate and kind because you just don't have enough rest to be resilient, to have that energy to be that person. And you really miss it. You think, where did I go? How did I get so lost in this? And it's this idea that we just don't have time. And it's so hard when you don't have time. Okay. What other thoughts do you guys have around self-care, care squad, taking on that leadership role in caregiving? And I'll also ask, who would you want to be a member of your care squad? So let's talk about that. Who's a good member of the care squad? Who would you want to connect with? That you think, oh my gosh, if I had this person, that would be awesome.
Well, I do think, this is Rebecca,
Hi, Rebecca.
if you have a caring spouse, it makes a tremendous amount of difference in how you're able to operate. But I know that there are many people who don't have a spouse, and they might not even have any family members nearby. And I've thought that through. I was very lucky to have a husband who was very supportive, but you know, a lot of people live kind of isolated lives anyway when they're caregivers. You kind of lose your friendships. You don't want to, but you do. You are alone and you miss your friendships and you miss different conversations about anything other than caregiving. And so it's not that it's intentional, but your extended care family, or however you want to say it, thins out.
Mm-hmm.
If you don't have those persons, is it feasible to hire someone? I mean, we may want cousin Sally to help us out. She's a real compassionate person, but she lives 200 miles away. Is it feasible to hire someone to kind of take the place of that person we would really want to be there? Is it paid for by any element that would facilitate it?
So I started doing a survey of family caregivers in 1995, and I just pulled out these paper surveys that I've kept with me over all the years to look at what was it that we wanted all those years ago. And you know what it was? It was connecting to support. And I think the support can be a support group, but it also can be one-on-one counseling or coaching. It's this opportunity to vent, to say, this is what's going on right now, to someone who understands and does not judge, that helps us with our stress release. So Sheri, you talked about this where you feel like you put on the face, you say, I'm okay, everything's fine, because that's what you need to do in that moment. You don't want your caree to feel like they are a burden to you or they are adding more stress to your life. If you had an opportunity to share honestly with someone who really got it, you have a chance to be released from stress, because the energy that we need to keep that in is exhausting. So Sheri, go ahead. I know you want to add.
I was smiling because my best friend pokes me because she told me early on that she's like, Sheri, you need help. And at that moment, I didn't even know what help I needed. And so I kind of snapped at her. And once I got into those questions of, okay, what do I need to what do I need? And kind of getting a handle on all of the things that were coming, the financial issues, the emotional issues, all of that stuff. And got someone who could consistently provide support for me and care for my mom. And I was telling her about that, and she's like, well, it's about time. You just about took my head off. You need those friends that can tolerate you having those moments when it just all explodes, and they're still going to love you through it. And kind of going back to technology, I think that that's a really important tool to figure out how we can make these caregiver groups feel a little more intimate. I think people are still kind of fishing around about it. Yes, no, maybe. But I do think it's an important way that someone in New York can talk to somebody in small town Florida or wherever and to share in that space of I understand, and create and so create that personal side that I talked about. You need your professional people like Deborah who can help you navigate all that stuff, but then you also need that personal side. And I think technology is a good tool for helping us build those friends and family members. Sometimes your help doesn't come where you expect it. So having a new tool that can help you reach into another pot to bring those support persons in it is really important. And I think we maybe should start thinking about how to make caregiving and technology a little more intimate so we can feel a little better in that space.
So I started my first online support group for family caregivers in 1996. And it evolved over a period of time into chat rooms on a website that I used to own. And we had family caregivers who came in every day at one of the 3 designated hours. And it was a family for them. And they just popped in to say, this is what happened to me today. This is how I'm doing. And over Christmas, we would do a 36-hour chat where we kept the chat room open for 36 hours and volunteers would take a time to be in that chat room so that at any point during a family caregivers holiday, they could go into a chat room and say, I can't wait for this to be over. And that's what they would do. They would just come in the chat room and say, I cannot wait for this to be over. When I started support groups in 1996, that was really kind of the only option for family caregivers, but now the option is Facebook. There are so many support groups for family caregivers on Facebook. It's really tremendous. There are groups for every disease process, for every caregiving situation. We also do chats on Twitter to talk about caregiving, and I started doing chats on Twitter in 2010. And it's interesting that you would think in this public forum, people would be very careful about what they say, but they just say what it is. This is how it is for me. This is how I feel today. This is what I struggle with today. This is what I need help with today. And I think it's all about creating a safe space, regardless of if it's public, so that when your message is sent, it's received with understanding and compassion and not judgment. In a caregiving situation, we are judging ourselves left and right all the time, right? And that's what I think oftentimes becomes what we hesitate about sharing, is because we're judging ourselves so significantly. We think, oh my gosh, if someone else knew, they would judge me too. When really we're all feeling that same emotion, that same struggle. And I just want to add one more thing about help. Oftentimes when we as family caregivers hear help, we think it's help for the caree. And then we think, oh my gosh, but I cannot take on that challenge. I could not get my parents to accept help or whatever it is. But we forget it's about help for ourselves too. And help for ourselves could just be saying on Fridays, I order in pizza. Twice a year, I have a cleaning service that comes in. Twice a year, I take my car to get it cleaned. You know what I mean? It's thinking about help in a way that's more expansive than just, oh, it's a home health aide for my caree. Help for us is whatever it is that gives us a break, a reprieve. And oftentimes it's not going to get a massage. So I have a lot of coupons to get a massage that I don't use. I've had them for years because that's not what I need. But if someone hired a cleaning service for me, I would use that all the time because that's what I need. Because that's what makes me feel good, to feel like, oh, I don't have that task on my to-do list. I have a little time because I don't have to clean. Okay, so would love to have you guys add any thoughts. If anybody would like to unmute themselves and add any insights, and then please continue sharing in the chat room. And then we'll close in just a couple minutes. I think in the chat room, if you guys wouldn't mind, I'd love to know what help helps you. When you think about help, what's the help that helps you? And I so appreciate all of you jumping in for this dialogue. It's been so interesting and so fun to be able to share these ideas and then expand on them and think about what's possible. Maybe this isn't possible tomorrow, but who knows what could happen in the next year or 2 years. Okay, so M. Forrest is saying good communication and responsive medical providers. Thank you for that. Thank you for that. My dad insists on having a doctor that is not responsive. We are always waiting for him to call back. And I'm always saying, why is he our doctor? But he is our doctor. So anyway, yes, I love this idea of responsive medical providers and responsive with, I think, patience for us, because sometimes we might not be able to articulate what the problem is, and then kindness in terms of, you can do this, really encouraging us.
Yes, and Denise, can you hear me?
Yes, go for it.
My supervisor, Lori, had a point that she wanted to share about caregivers and the care receiver engaging them, keeping them engaged also helps the caregivers. Lori, you want to?
Hi, Denise. Can you hear
Hi,
me?
yeah, thanks for being here.
Okay, so I just have a couple of things. When you guys were talking, it just come to my mind, and I was telling Mitch about it. I took care of my mom for 8 years, and it finally got to where probably 2 months before she passed, I spent 63 days in my house without a break because I didn't know this agency existed or the services existed. But I became kind of creative in how I dealt with mom. And one of the things that I noticed was all her life, she got married at 14. All of her life, all she did was cook and clean and take care of babies. And I ran out of things for her to do to keep her occupied, and she would be so bored. And I finally said, Mom, I need you to fold this laundry. So I would give her already clean, folded laundry and have her fold it. She would sit there for 2 hours and just fold laundry, and it had to be just perfect. And that gave her so much satisfaction. But more importantly, it gave me a break. I would be able to go take a shower, knowing that she was okay. I always had the door open in my shower, so whoever came in my house. And then another thing is, we were talking about others helping us. And I had no help other than my husband. And I've got 3 brothers and a sister, and their perception was out of sight, out of mind. So if they didn't see mom, they didn't have to think about things that mom was going through. She had calciphylaxis in both legs. She was on dialysis 4 days a week. I mean, she was in bad shape. So it finally got to the point where I had to go to Nashville, and I called my brother and I said, you have to take mom. Just for 3 days, just take her. So he come and got her, and he took her for 3 days, and he called me in Nashville, and he was almost in tears. And I'm like, what is your problem? He said, how do you deal with this woman every day? She's crazy. I said, she has Alzheimer's and dementia and Parkinson's. She's a dialysis patient. She's in pain. She's going to be crazy. You just have to deal with it. They don't understand how to deal with it, but they expect you to understand how to deal with all the stress and taking care of somebody. There's more to it than just getting them up and getting them something to eat. There's much more to it, and people just do not understand.
Yes.
So
yes,
I advocate for, at the time I couldn't get my siblings to do it, but I advocate for if there comes a time when somebody has to take over as caregiver, that you have a family meeting and you set up a schedule and enforce that schedule. Because one person cannot do it. I thought I was going to lose my ever-loving mind.
yes,
And I said, you know what? If I wasn't such a coward, I would have committed suicide a long time ago because I just couldn't do it anymore. And we lost mom in December of 19. And it was bittersweet. It was a blessing, but yet, I miss her terribly today. But her care was my concern for 8 years. And it's hard to transition from that to getting back to a normal lifestyle.
exactly. And there is nothing in place that helps former family caregivers adjust. And that was one of the other ideas that I had for the Care Squad. Then they continue the support. There's a tough day after a Carrie's death where the medical equipment supply company comes in and removes that medical equipment, and you're there by yourself. And then all of a sudden there's this tremendous void in your house. And if you had people who got that, who understand how significant that moment is, they can be there to support, even virtually, and say, okay, let's think about what do you want to do with that void today? And if they say, I don't want to do anything, you say, okay, let's just talk it out. I think,
My sister brought me over a bottle of wine and said, let's sit down and think about mom.
yeah, right. Yes, right. Yeah, there's just so many moments during caregiving where you are alone and they are significant for you. And it would be just so helpful if others who know that before those moments come, so they can be there for you for those moments. Okay, we're going to close. So Sheri, thank you so much. Sheri, for those who'd like to be in touch with you, how can they reach you?
You can follow. Oops, I didn't get to my last slide because that's my last slide. But you can follow me on Facebook at Praxis for Care, Praxis for Care. I do my weekly blogging there. I'm also on LinkedIn at Sheri and that's SHERI.L.Yarbrough, YARBROUGH. And then my email is slYarbrough@praxisforcare.com.
Okay, thanks everybody so much for being here today. We convene again tomorrow to talk about 2 more big ideas. Just love the conversations and all the expertise and insights that you have brought today, and looking forward to more tomorrow. And again, if you're here for CEUs, look for an email tomorrow afternoon after tomorrow's session with the link for the evaluation. Okay, thanks everyone. Take care. See you
Thank you.
tomorrow.
Bye-bye.
Thank
Thank you.
you.